Hello, everyone. This is Marika from Herasphere, and today I'm delighted to be talking again to Lily, also known as the Pilates nutritionist, Lily Nichols. And some of you might remember because we did have a chat a couple of years ago about gestational diabetes. But today we're going to talk about nutrition in pregnancy, and in particular, how women can introduce real food in an easy way. So, Lily, before we jump in on the questions, would you like to tell us a little bit about yourself?
Sure. Yeah. I think when we were on before, we were talking about real food for gestational diabetes, my first book. So I'm a registered dietitian and certified diabetes educator. Also work a lot in research, and I'm an author. I write a lot too. And the culmination of a lot of my work led to writing the book, Real Food for Gestational Diabetes, which presents an alternative to conventional gestational diabetes advice. So it's a lower carb, more nutrient dense approach. So much different than what most pregnant women are given. I think from the time, it's crazy to think back to just 2 years ago, because the book really took on a life of its own. And I didn't expect it to grow as popular as it has grown, but it was
Really?
kind of, it's all over the place now. It's influenced international prenatal nutrition policy, which is very cool. There's a country that dropped the mandatory minimum requirement for carbohydrates from their guidelines, which is awesome. A lot of practitioners also have changed their practice. It's used in a couple nutrition schools in the maternal nutrition course here in the US, recommended in certain medical schools as well. So it's really filled a void that I didn't expect it to fill, and that's awesome. Shortly after the release of that book, I started getting asked, do you have recommendations for a prenatal nutrition book, like not related to gestational diabetes? Because it seems as though the advice that's in here would be good for all pregnant women. Shouldn't all pregnant women eat a diet that helps to balance their blood sugar, is full of nutritious foods, doesn't have processed stuff, is low in sugar, and all the benefits that I lay out for, fetal development and all that stuff? And it was like, well, the obvious answer is yes. However, as I started looking in the market, I couldn't find a prenatal nutrition book that really covered things from the real food perspective and covered things in the depth that I would hope to see them covered. Mm-hmm. And also, I felt like the authors weren't willing to take on some of the controversial topics. It was just like, well, we'll just lay out the guidelines. Here's these foods to avoid.
You're not afraid to poke the bear, though.
Here's this amount of carbs that you have to eat. It's absolutely required, bar none. They just weren't up to date. And so I really couldn't recommend any. So I had a lot of practitioners giving their clients this book on gestational diabetes and saying, hey, you don't have diabetes, but do this anyways.
Yeah.
I was like, okay, eventually I just had to write the second book. So I'm just about to launch my second book, Real Food for Pregnancy, which I'm very excited to release. It's absolute miracle that it has been written, because since we talked, I had a baby. So
I think
with a baby turned toddler in the house, it's just madness. But it is here and written, so I'm really excited.
And off the top of your head, Lily, how many references are in this book?
I've added it up recently, so you're not catching me off guard. 934.
Because I know you're a little bit nerdy like me, and you tend to dive into the research and just kind of get a little bit, it's easy to get a little bit sidetracked, isn't it? And just sort of fall down a rabbit hole and go, oh my gosh, this is really interesting.
Yeah. And that's me cutting myself off, because those were the ones that made the cut. So how many research articles did I read through? I don't even want to know the count. When I added up the final tally, I was just like, are you kidding me? I mean, how many nursing sessions was I sitting around on my phone, scrolling through Google Scholar, pulling up studies? It's crazy.
Yeah, it's so easy to do, isn't it? That's amazing. And I can't wait to see this book, which I did have the pleasure of reading and reviewing the exercise section, which is
thank
great.
you for that.
Oh, you're very welcome. But let's jump into nutrition, because obviously that is, your area of expertise. I'm just curious if you wouldn't mind just running through some of the common misconceptions when it comes to nutrition in pregnancy, because I certainly hear some that make me raise an eyebrow, but I'm interested, from your perspective, what you see are some of the more common misconceptions about the way that women should eat in pregnancy that maybe they hear from their doctor or from a friend or from the internet, or just off the top of your head, what can you think of?
Sure. I kind of want to hear the ones that you hear, actually, before I dive in.
What are the ones I hear? A lot about how much women should eat.
Okay, yep.
The calorie counting kind of side of things. The low fat. You don't want to be eating too much fat or you'll get fat. They're just when I look at the meals that are prescribed, and this is probably more from a gestational diabetes perspective too, but a lot of the what I would say is just sort of empty processed calories, a lot of the cereals that are high in sugar, which really surprises me, especially from sugar management, but a lot of recommendations for sort of, the standard cereal with milk and lots of bread, which again, none of which is bad. Like, I think variety is good. But I'm just surprised that there doesn't seem to be as much of a focus on, I don't know, vegetables and healthy fats and things.
You brought it, you bring up some really good ones. I'm glad you mentioned those. I'll tackle those right now, actually. So
sure. Okay.
You brought up and I'll add some more onto it, of course.
Yeah.
How much to eat during pregnancy. There's this whole eating for two idea.
Yep.
You need to eat, which people interpret as you need to eat double the quantity of food, which actually is not the case. When they estimate calorie requirements in pregnant women, they tend to go up in the second and third trimester, but the amount they go up is not double by any means. It's like, at best estimates, it's about 300 calories extra, which is maybe a small snack or two during the day, or a slightly larger portion at your meals. There's even some estimates that suggest that amount even overestimates it for some women. So it can go up as little as 70 calories a day, actually. A lot of this is because women's energy expenditure, sometimes by physical activity, sometimes goes down as well. So this whole energy balance thing, your body kind of takes care of it. You don't need to eat double the amount of food. What you need to do is eat more nutrient dense foods, because your nutritional needs do go up. So total energy, not that much, but for example, vitamin A needs go up 30%, iodine needs go up 50%, iron needs go up about 50%. I could go on and on. Folate needs go up, choline needs go up, vitamin B12 needs go up. All these nutrient needs increase, whereas the total amount of food you actually need to eat doesn't all that much. So it's a matter of just making every bite count, really thinking about the nutrient density of your food.
How do they figure out how much extra for those vitamins? Like, how do they do the research on that? How do they just determine, you need X amount more?
The science is not perfect. So the way the recommended daily allowances are set was actually most of them are based on adult men. And then they put it through a mathematical equation that accounts for what they suspect are the increased maternal tissue needs, mostly based on weight gain, and what they anticipate are the fetal demands for this nutrient. But it is not perfect because, for example, vitamin B12 needs, they've found that the RDA underestimates vitamin B12 needs by a factor of 3. In other words, you need triple the amount of vitamin B12. So if your prenatal says like 100% of vitamin B12, you certainly hope you're getting 2 times that amount also from your diet, or taking more. So this is especially important for vegetarian or vegan women, because you don't get B12 from animal foods. Choline needs, for example, and these were set in, the earliest ones in the US were set in 1998. This is like a very recent nutrient that's been added to the whole thing we think about with prenatal nutrition. Everybody's hardcore on folate or folic acid, but choline plays an equally important role in neural tube development and brain development. So if you're deficient in choline, you're also at risk for neural tube defects. It's not just folate. The choline needs are not probably not as high as they should be, because when they're looking at both rat studies and now human experimental studies, really well controlled, like randomized placebo controlled trials where they're supplementing women with the RDA or double the RDA. Rates of placental inflammation, all these signs that are risk factors for preeclampsia, those are all lower in the women who have higher choline intake. And also when they test infants' brain development, this is after they're born, these infants test higher on cognitive tests, specifically reaction time, than the infants who are in the ones that just met the RDA. So even the needs for choline, like, probably aren't perfect. So it's tricky.
Yeah, that's really interesting. And I guess they could, if you have too much, your body would presumably, in most cases, find a way to excrete it.
Well, in both of those cases, they're B vitamins. So yes, B vitamins, they're water soluble. You tend to pee them out in your urine. I mean, you certainly don't want to go ridiculously above and beyond needs. But these are just two examples where the science is not perfect. And so sometimes we have to take into consideration, like, what did traditional cultures do who have a long history of having healthy babies before the advent? Like, we didn't even name most of our vitamins until the early 1900s. The only reason that choline isn't called like vitamin B72 is because it wasn't identified in the 1910s, 1920s. It was identified much later. So our understanding of like what's important for fetal development and for pregnancy health, I feel like, is in its infancy. And yes, I like obviously care about the research and look at it in depth, but a lot of what we find from that research, if you look back at the foods that were emphasized in traditional cultures before and during pregnancy, those are the very foods that are rich in these nutrients that we're now showing, hey, these needs are a lot higher than what the current estimates are at. So that's a very important point to keep in mind.
That's really interesting. I know that you and I we can go off on all sorts of tangents.
Oh yeah, I love it.
I'll bring it back to, let's go back to those misconceptions, because
oh yes,
where do we get to?
You're talking about the grains.
You're talking about food, and then the low fat, and
that kind of goes hand in hand. So
that kind of stuff.
If you recommend higher carbohydrate intake, which the current guidelines do, it's 45 to 65% of calories. So approximately half, or probably more calories coming from carbs, which is a lot. By default, that requires you to be low fat. In order to comply with the high carbohydrate intake, your fat intake then goes down. Protein can stay relatively stable without much of a difference on those two. Unfortunately, the other thing I'll say before I dive in is that, at least in the American guidelines, they specify make half your grains whole, which means half your grains can be not whole, or refined grains like cereals and white bread and pasta and whatnot, which is, in a way it's like, okay, they're being nice maybe, but in another way, when we talk about how all these nutrient needs go up, but total energy needs don't quite as much, then it doesn't make sense to be filling up on empty carbohydrates. And when you start to look at the research, there's some really interesting studies that have looked at micronutrient intake in pregnant women. So micronutrients are like the vitamins and minerals, whereas macronutrients are your fats, carbs, and protein. So women who tend to eat a higher carbohydrate diet, especially high in refined carbohydrates, their micronutrient levels are lower across the board. So the more that women focus on the low glycemic carbohydrates, like vegetables, fruit in its whole form, dairy products that include some fat with it, not the low fat ones, legumes and beans, getting your carbohydrates from those versus getting all your carbohydrates from bread and cereal and pasta and crackers and white flour products. Yeah, obviously your micronutrient needs are higher. I mean, it kind of makes sense. So I have a whole bunch of other issues with the carbohydrate recommendations. That's just one of them that I'll touch on. In terms of fat, again, I say it goes hand in hand, but unfortunately, when a lot of women limit their fat intake, they by default are limiting some very nutrient-dense sources of food. So eggs, for example, I'm going to cut back on fat, so I'm not going to eat the egg yolks. Well, eggs are one of your number one sources of choline, which is really important for your baby's brain development. And it also has protein and other good stuff in a bunch of other minerals, trace minerals, and DHA and vitamin B12 and other good things, it's silly to take out part of the whole simply because it contains fat. But often that's exactly what the recommendations suggest.
I've not seen
chicken with the skin on. It's the same thing. You take the skin off, you take out the fat. Okay, great. What do you take off when you take off the skin? You're also taking off this amino acid that's really important for your baby's skeletal development, for their organs, for their skin, for your own stretching skin. It's an amino acid called glycine, and it's most concentrated in the skin, bone, and connective tissue of animals. So most people love eating like a drumstick with crispy skin, and you actually should do that. It's better nutrient-wise for you than to not do that. But if you're trying to comply with this low-fat thing, then you would just throw away the chicken skin or only eat boneless, skinless chicken breasts, and you might actually be deficient in this amino acid. So 2 tiny little examples to explain part of why that's my stance.
That's awesome. Any other common things that you see in pregnancy guidelines that just make you scratch your head a little bit?
You know, there's so many. One,
there's a whole book with 900.
hence a book. I'll point out one more. So I feel like a lot of women come into pregnancy and the first question they ask is, what foods do I need to avoid? It's like top of mind. You don't want to eat something that's going to hurt your baby, right? And most of these foods to avoid lists are based almost entirely on food poisoning risks, because you are more at risk for food poisoning when you're pregnant, just with the changes in your immune system. Unfortunately, what these guidelines don't necessarily take into consideration, is if recommending complete avoidance of these foods also limits nutrient intake, which, newsflash, it does. And B, what are the relative risks of people actually getting sick from these foods? So I wish I had the stats handy right in front of me, but for the risk of like getting listeria and a listeria infection or listeriosis from deli meat, it's something like 1 in 83,000 servings of deli meat for a pregnant woman.
Oh, wow.
Like the relative risk is very, very low. The chances that an egg contains salmonella is anywhere from 1 in 12,000 to 1 in 30,000 eggs.
Wow.
So very, very low relative risk. And then furthermore, that risk is dropped 7-fold if you're getting eggs from an operation that allows their chickens to like be outside on pasture, because they're not in these confined dirty barns spreading salmonella among each other. So the actual risk of getting sick from some of these foods that are super off limit, eggs with runny yolks, deli meats, just to give out 2 examples, is very small. And then often what replaces those foods isn't as nutrient dense. So you say you're a pregnant woman who really likes eggs over easy, and you're like, oh no, I can't have eggs over easy because I might get salmonella. I don't want to have any eggs because scrambled eggs turn my stomach or whatever. Pregnancy is weird, right? You have weird food things. I'm one of those like only eggs over easy kind of people, so I get it. What do they replace instead of the eggs? Well, it's usually something like cereal or oatmeal or toast or bagel, or it's something that doesn't have choline in it, that's lower in protein, higher in carbs, often refined carbs, or like oatmeal, for example. Yeah, you're usually starting with a whole grain, but then you add a whole bunch of sweeteners and other things to it to make it taste good, right? So you end up with this really imbalanced meal instead of having something that was really satisfying, nourishing, high protein, nutrient dense, blood sugar balancing. So I think it's just it's a slippery slope if we get super literal on all of these foodborne illness things. And to play devil's advocate for just a minute, because people sometimes think this stance is like super rogue. If you look in the US anyways at the risks of food poisoning, about half are actually due to fresh produce, fresh fruits and vegetables. But nobody tells pregnant women to steer clear of a spinach salad. Yeah. Even though you're far more likely to get sick from spinach salad, and those infections often land you in the hospital as well. Like about half of the food poisoning infections that are require hospitalization are the fresh fruits and vegetables.
Are you talking about prepackaged salads?
Prepackaged salads are one of them, but just the whole category of fresh produce itself is the highest risk. The two are fresh fruit, and the second one is leafy greens. So
if you wash
those
them fully, is that
would conceivably help. Yes. I think a lot of it is part of why we see such big outbreaks nowadays is that you have these large processing plants for processing these greens, the ones that come all bagged and pretty. Whereas, so if one leaf of spinach has bacteria on it, and then they don't get because they usually put chlorine and other stuff in the water to disinfect it, if they don't get that balance exactly right, or it's not held at the right temperature, whatever, if things can become contaminated at many different places in the supply chain, you're much more likely to infect a whole batch of spinach versus if you're on the field and one leaf has salmonella, you might get one person who may get sick from the salmonella versus that's now been spread amongst this whole vat of spinach being watched, and then that's spread out to how many millions of people, then you have some bigger issues. So certainly something to consider.
That's interesting. I'm just thinking back to my pregnancy when I was in the UK, and I certainly had runny eggs, but when we were talking about things like ham, they used to say it's fine to eat it, just when you open the packet, have it when it's nice and fresh, and then don't eat it later, was kind of the guidelines that we were given. Is that pretty similar to what you're told?
I mean, that's pretty good common sense advice. There's a lot of what it is it comes down to food safety. The thing with listeria that's tricky is that listeria is one of these weird, crazy bacteria that can reproduce at refrigerator temperatures. So it's not all about food handling or like storing things at the right temperature. Listeria can still breed in the refrigerator. And that's why they have these guidelines the way they are. Again, the chances that it actually does have listeria is very, very rare. So like one of the guidelines, if you're really going to take it super strict, you could heat your deli meat until steaming. I find heated deli meat, unless we're talking like, I don't know, a toasted sandwich or something, kind of find it repulsive. It like releases a lot of odors that would be like really would have not worked with my stomach when I was pregnant. But that's what some people will opt for, to like make sure they've like killed the listeria. I do think it's smart, like you said, if you get a package, like eat it the first day or the first 2 days, but like don't be eating ham that's been in their fridge for a week or more. I think it also makes sense to buy the stuff that's prepackaged versus the stuff that they cut at the deli, because maybe they haven't sanitized like the cutting blade on the deli slicer. So that's something to keep in mind. If you're at an event and something's been out for a while, there's like a tray with deli meats and whatnot, then probably best to steer clear of that, because listeria can multiply in the fridge, but it does it way faster if it's at room temperature or slightly warmer than that. So, some of this stuff really is common food safety. And then you also just have to consider, what are the relative risks? And then what's the alternative? If I don't have this food, what's going to replace it? Will it provide the same nutrients that I'm getting from the said food? And is that risk versus benefit equation working in my favor? Some people are like uber crazy about food safety and don't think any of these risks are worth it. And so they will cook their eggs until the yolks are hard, or do scrambled eggs. That's totally fine. If you're still eating eggs, I'm happy. I don't care how you cook them. If you're still happy, if you get enough protein with cooked deli meat, or don't do deli meat and get your protein in other places, I'm happy. I just don't think it's fair for us to only focus on those foods and then give these fruits and vegetables a pass when they're the ones that are giving us most of the issues. If the guidelines were really going to be so careful, they would tell us to cook all of our leafy greens and to not buy pre-cut fresh produce, because those are the ones that are most likely to have these bacteria. And I actually do suggest that in my book, that you don't buy pre-cut produce. Get it whole, wash it yourself at home, cut it up fresh at home, because that'll reduce the chances that things get infected. So it's just, I feel like it's just cherry picking data. That's all.
Sure. No, I agree. Okay. Now, just going back to, we've talked about these common misconceptions, and I know I was just going to ask you whether you think some of these things have changed, and I suspect things are evolving based even on when you're talking about your introduction, Lily, and how people are just taking on board some of the science and some of the recommendations. Do you think on the whole recommendations for diet and nutrition in pregnancy is changing? Slowly?
I think there's a little bit more appreciation for some newer nutrients on the block, like choline.
Mm-hmm.
So recommendations to throw out egg yolks, I'm seeing less of that. Although when I reviewed the suggested sample diet for pregnant women that's put out by our dietetics association here in the States, the only eggs present on the meal plan were what was found in low-fat salad dressing, or low-fat mayonnaise, sorry. So I'm not like holding my breath here for us to see major changes. It's like I see the nutrients discussed, but then when it comes down to the foods, people get super scared because oftentimes it means we're recommending a diet that has less grains and more animal foods in it, which is the opposite of what's being pushed by our dietary guidelines as a whole. And I think it's really scary for policies to change and for clinicians to change suit. I think what we're seeing more is that individual clinicians and institutions are making changes. Or like I said, with the policy change, that was in the Czech Republic. I don't know what is, more forward thinking about their country. It's a lot smaller than the US. Maybe there's less lobbying dollars from the food industry. I don't know. But they were able to they completely flip-flopped their gestational diabetes guidelines. They previously had that pregnant women should have a minimum of 100 grams of carbohydrates per day. And they switched it to they should have a maximum of 100 grams of carbohydrates per day.
That's
and didn't put any minimum. Yeah, very, very different. And they're seeing excellent results. They're seeing almost a very low rate of women requiring daytime insulin or medication to control their blood sugar, which is great. Yeah, because they're not spiking their blood sugar with as many carbs. It's just simple. I mean, it's almost cause and effect with the blood sugar and the carbohydrate situation. So I am hopeful that things will change, but I think because the changes required will question so many of the tenets of our current guidelines, I think it's going to take some time.
Yeah, I think maybe even the general public will push for some of this more so than institutions. I just think as people read more, become better educated, learn more about food, maybe the pregnant women themselves will be directing some of these changes.
Yes. I mean, I have some dietitians I've heard from where they have given my book. Now this is the first book, so the new one is out this week, so I haven't had a chance to give this one to their supervisor. But they've given Real Food for GD to their supervisor and been like, hey, actually it looks like a lower carb diet might be a better option and is actually safe. Here's this book that lays out the evidence. And I've heard from some that they've been able to change their policies. So they've been able to change their education materials, so you don't have a sample meal plan that has oatmeal for breakfast with fruit and milk, which is what's actually the current recommended breakfast.
Low-fat yogurt for morning tea
in the US prenatal sample diet. Yeah, it is literally oatmeal, strawberries, and low-fat milk. Anyways, you will have less of that with a sandwich for lunch with fruit and milk or whatever, and you'll have more of the whole have eggs for breakfast again. We were just so scared away from eggs with the anti-fat, anti-cholesterol guidelines that it is a complete paradigm shift for dietitians. And I know I went through conventional training, so I know all the things that they're told. I just had a dietitian in training comment on one of my blog posts. I think I was talking about coconut oil, and she's like, how could you recommend coconut oil when it's one of the fats that's highest in saturated fat, and that directly raises LDL cholesterol, which raises the risk of heart disease? This is in stark contrast to what I'm learning in my dietetics training. And I replied, I was like, yeah, it is in stark contrast. This is your chance to use your education's institutional library and read the research. And here's a post that has all this research that you can read. It's just going to require a complete 180. And I don't know how soon that'll happen.
Yeah. Yeah. I mean, I guess for most of us, we don't like to have our beliefs challenged.
It's scary
It is scary,
for
especially if
people.
you're particularly invested in that, or if you've been doing it for a while, or you have a name built around that, those concepts. It can be very hard to kind of go, do you know what? I was wrong. But,
Right.
you know, we as health professionals, like, we have to evolve, and we have to read the research, and we have to move on and make sure that we are up to date, really.
Yeah.
So if anyone's really interested in nutrition, obviously get Lily's book, because she's got all the research laid out for you to make it nice.
I know I'm going to have some people who are pretty frustrated by having my recommendations are just very different than the guidelines, but that's why I'm so diligent about citing research, because if you want to look into why I came to the conclusion that I came to, here is the study, read it, see if that makes sense to you. And at least it's planting the seed. I don't expect people to change like everything, but I think a lot of it, like you said, is consumer driven. You have really informed women coming to their healthcare providers being like, hey, you know, why are you telling me to eat XYZ? I thought, especially with a lot of people eating more like paleo, low carb, like ketogenic diets getting pretty popular, they're all a little different, but what they have in common is there tends to be a focus on real food, regardless of all the arguments about how much or how little carbohydrates you have. And all of them are lower carb than the conventional guidelines. So by default, that like flies in the face of all the macronutrient recommendations. And if anything, I would just hope that clinicians would be up to date on if that makes sense, because there's not one diet that works for every person. And some people will do okay on a slightly lower fat, higher carb approach. And if that works for them, awesome.
Yeah.
And if it doesn't and they want to do something else, here's the research to do that too. And hopefully their clinicians will, you know, take it into consideration as well.
I like that you brought up the individual variations, because I do think some people have this concept that there is one particular way to eat. And I think you'll know from your clinical experience, and certainly I know from my clients, that, you know, two people can eat exactly the same and have a very different reaction in their body. And I'm not just talking about fat loss and things like that. I'm talking about, you know, energy levels as well, and how they feel. And, you know, obviously I have 2 celiacs in my house, so we tend to have a, you know, gluten-free.
Yeah.
Which kind of, you know, started us on a real food train. And
tend to have to stay gluten-free in the household, right?
Yes, we do have pretty much a gluten-free household. My daughter does have gluten from time to time, and I might have it when I'm out and about, but it's very interesting, because that really completely changed how we all had to eat as a family. And there were actually a lot of benefits off the back of that, because, you know, when you, I mean, there's a lot of processed gluten-free crap though. I mean, if you just take gluten out and replace it with gluten-free processed stuff,
sometimes they're worse too. It's true.
But, you know, taking it out and adding more of the real food in it made a big difference for us. But I digress.